Well, hello everybody, and our NHS staff survey results for last year are published today. It's really good to be able to see all of your responses, and our response rate was about just over 53%, which is a slight reduction on where we were last year. But when you compare us to other organisations who've had very significant drops in the number of respondents, we are above the average of our type of organisation, which is really good news, because clearly the more of you that reply to the staff survey, the more of us that input into that, the more of a clear mandate we're getting about how it feels to work in the organisation. So this is the second time that the staff survey has covered the 7 themes within the NHS People Promise, and of course those 2 other areas around staff engagement and morale that are so important to us. And I guess when I look at the outcomes, they're very similar to, the results are very similar to what they were in 2021, except for the area around recognised and rewarded at work, which is a little bit lower than it was, and the sense of team within where we work being slightly improved. It's good to see that despite some of the difficult circumstances, the number of colleagues recommending the Trust as a place to work have improved slightly. But those who are happy with the standard of care that they can provide has reduced a little bit. So slightly different outcomes for each of those 2 really important measures. There are some areas where we're performing better than the previous year, and they're things like they're areas like improved experience linked to kindness, to civility and respect, and also the number of colleagues feeling that the organisation is taking action against or taking positive action on health and well-being. As well as how positive it feels to work within a team, so that sense of team working. And from the staff survey results, there are areas that we need to focus on in terms of where we need to improve, and this is about appraisals and those appraisals being linked to continuous development and career pathways, how we improve the experience of all colleagues throughout the organisation, how we address the disparity of colleagues with protected characteristics, and how we help and support colleagues to feel safe to speak up and report issues. And what's interesting for me is when I look at these areas that are more positive and the areas where we need to improve, this is what I hear and what I see when I'm out and about in the organisation. So it is the things that you are telling me when I'm out having conversations with you. I also feel that we need to acknowledge the dissatisfaction that is clear in the results of the staff survey on wages, and therefore that means it's important that we continue to support colleagues to take part in industrial action whilst that is ongoing, and also where we continue to offer support around the cost of living. Now, we also surveyed our bank colleagues, and we had a response rate of about 30%, and the results were really helpful in that they showed that there's a great enthusiasm about the work of our bank colleagues and our action on health and well-being, but we definitely need to focus some more on how we support bank colleagues to feel part of our broader team. So the staff survey, for me, it's really, really important. It's a touch point during the course of the year in terms of telling us how you're feeling, how it feels to work in Notts Healthcare, the areas that we need to focus on. So these results will be the focus for ongoing change, ongoing improvement. There'll be lots of opportunities for you to get involved, so please keep a lookout on how you can continue to give us that really important feedback. And of course, as with everything, there's lots more information on Connect. Thank you.